And I think boards have to be prepared for this transformation. After all, they're partners in leadership of the organization. So in order to get the organization to transform, they need to transform the work they're doing. And so what we've done over the last year and a half or so is study boards that are sort of leading transformation for their organization and trying to tease out the characteristics that make them effective in leading the transformation. Well, first, I think they have to look at their current practice and see it's up to generalized acceptable standards for boards. How do they select themselves? Is it just on the basis of knowledge-based skills, or do they really look at behavioral-based skills and competencies that can help them do some of the work that's needed for transformation? They have to look at how their meetings are organized. Do they have time to ask the deeper questions, to really weigh the risks and the gains from some of these new organizational structures that are proposed either by ACA or by insurance arrangements that they're dealing with? So they really have to be able to create in their own work environment an opportunity to be much more generative about their work, much more strategic about their work. So I think there are some boards that are there. They have the fundamentals down very, very well, and they're beginning the transformational work. There are other boards that still sadly have to come up onto the fundamental level in terms of selection, education, development, and those are the boards that really need to get moving now because there's not going to be a lot of time to do it. And unless you have those foundational pieces in place, do they give voice to their stakeholders? Are they composed to reflect their community? Are they asking the right questions? Do they have board meetings that facilitate dialogue? Unless they have those, they're going to find it very hard to begin some of the transformational practices that are out there. I think the major opportunities for boards is around how they build their board culture, how they tolerate discussion, how they weigh options back and forth, spending time on taking contrarian views as well as supportive views, making sure those are balanced so that they have a fair hearing of what the decision is all about. But I think one of the key things where there's a great opportunity and where I'm a little concerned about boards is their ability to tolerate risk. A lot of what we're doing now, we don't know what the outcomes are going to be. And boards are used to having budgets that they want management to comply with and having strategic plans that they measure results. A lot of what we're doing right now, we don't know what the results are going to look like, and boards have to be accepting of that, being able to tolerate that risk for a certain amount of time and not rush to judgment about whether a certain experiment around new models of care is a failure or a success. One of the things boards how they can impede this is fail to appreciate the transformation that's going around now. Not be educated enough to see that there are new models of care out there, new financing strategies, and understanding that we can't afford to deliver the care the way we've been doing it up to now. There's just not enough money to do that. So they have to appreciate that we are, first of all, in an age of transformation. Secondly, they have to put their own self-interest as a board member or as a member of the board behind them. Because if the affiliation is the route to go, they have to understand they need to do what's best for the community they're trying to serve. Their mission is all about the health of their community. And what they need to do is, how do we make a decision that advances that health? How do we make a decision that supports the mission, even though it means I sacrifice my own board position in doing it? I think the most important conversation boards should have is, what are we here to do? What's our purpose? What do we want to be when we grow up? We're not going to be just an acute care hospital anymore. We have a much bigger mission around supporting our community's health, engaging the community in their own health, and providing the best possible care we can. You know, we talk a lot about fulfilling the triple aim of, better patient experience of care, improved health for the population, and good stewardship of the resources we have in their effective use. Boards have to have a conversation about how do we achieve that triple aim for our community, and is the way we're doing care today the way we really need to continue to do care to best accomplish that triple aim.